How would you like to control your schedule, increase revenue, and be an exclusive concierge provider? Let's talk KidKuts. KidKutsMD is our mobile concierge plastic surgery application for use for children and adults too, but particularly children in their time of need when they have minor injuries, lacerations, and other minor injuries. So I would like to talk to you a little bit about how KidKuts works. First of all, what is KidKuts mobile app? The KidKuts mobile app is the first app of its kind in plastic surgery, whereby a plastic surgeon specialist is linked to the patient or the pediatrician or the point of care provider, and he or she can initially evaluate the digital image of that child's injury and help establish a care plan. Once that's done, the care is then coordinated in a concierge way with the patient or the point of contact for that board-certified plastic surgeon to meet the patient at the office or other preferred facility. By doing this, we're able to eliminate emergency room waiting times. We're able to ensure prompt specialty care, a positive experience, and optimize cosmetic results. Who is KidKutsMD designed for? It's designed for point of care providers, such as a parent, a pediatrician, primary care provider, an urgent care doctor, school nurses, sports teams, and adults use the KidKutsMD app almost as much as they do for kids for themselves. We've had many adults using the app in order to basically obtain prompt concierge access to their local plastic surgeon. And it's as simple as these two steps. The parent or point of care provider registers on their phone, takes the picture, hits submit, and they are on the phone at that point with one of the KidKutsMD coordinators, basically making plans for care. It is fast, it is easy, it is 2 swipes on a iPhone. You basically select the area you live in this case Dallas, what type of membership you would like, and each different membership has a different level of service. Put in your insurance information, take your pictures, you can add any messages to the doctor that you want and a callback number. So within, you can see here, 7:36, 7:37, within 3 minutes, the patient is already on the phone with the plastic surgeon's office with the expectation that care is being coordinated in a very prompt way. So why would plastic surgeons want to get involved with KidKuts? What are the benefits to plastic surgeons? Well, for a younger plastic surgeon just starting their practice, KidKutsMD is the ultimate marketing tool because rather than taking on call for the local emergency rooms and getting called at 2 o'clock in the morning, the KidKuts system really provides that patient access to you when and where the injury happens. And so oftentimes these injuries happen during the day, at a daycare, at school, on a Saturday morning during a soccer game. And so this basically skips the step of the ER, and it makes the care very efficient. It puts the patient in direct contact with you and skips the step of the ER. So for a younger associate with this marketing tool, this could obviate the need to take emergency room call. Another very important benefit is control of your schedule. So for the younger associate or even the more senior associate in a plastic surgery practice, having control of your schedule is extremely important. When you're taking emergency room call, they're gonna call you when they need you, and the expectation will be you will be prompt. When you have control like you do with KidKuts, you can make the plan with that parent or that patient to come to your office, say at 4 p.m., even though the injury happened at 1 p.m. or noon. You can find out whether that child has had lunch and whether they need to be NPO, whether they need to be sedated. And ultimately, that allows you to control your schedule. And this is really important for younger associates. Another nice benefit is that once you are in control and you have made that contact with that patient, you decide the facility of choice that you're going to deliver the care. That might be your office. That might be your outpatient surgical facility. That might be the emergency room or urgent care downstairs from your office. Or that might be another ER. And so the facility preference, the schedule of control are all things that you don't get when you're on emergency room call schedule. The other benefits to both a younger associate growing their practice and, more importantly, a senior associate are the ancillary services. What I mean by that is that once you develop a relationship with the parent, say, of a 3-year-old toddler that fell and split their lip, you're developing that relationship one-on-one with that parent. That trust is there. You are basically making that relationship with that parent that will be there for years to come. And when that parent, mother or father, grandmother in many cases, decides that they want to do a other type of cosmetic procedure, you have that relationship. For both the younger and the more senior doctors involved, subscribers, we have an exclusive licensing network. And what I mean by that is that when you are the provider in your local area, you basically are the exclusive provider for that area. You have a certain radius around your office that the KidKuts app will automatically send you any of the referrals in that area. It's exclusive because it's geographically limited, and it means that if you are the provider in that area, you are going to be picking up those calls and those referrals. And that is important for someone trying to grow their plastic surgery practice, but it's also important for a senior associate, say with younger associates or fellows, because the app fees associated with KidKuts are part of the revenue that is derived from the KidKuts app. And I'll show you that in a minute. This is just a quick schematic of a monthly return on investment. So if the average provider pays a monthly licensing fee of about $495, this is the return that they are getting into their practice during that month based on the number of procedures. And I've put very conservative numbers here. On average, we do about 12 to 15 injuries per month between the office, the ER, but these are all KidKuts app derived injuries. And so I'll break it down here. This first line actually shows the app fee that you are generating for your practice. That second red line is the additional referral fees that are generated by the app. So with those two boxes there, you're already generating about $5,000 per month. The gray is the laceration repair fees that you're generating. So on top of that 5, you're generating another 7 there. The turquoise bar represents the secondary revenue that you derive from the KidKuts relationship, that being scar care, laser treatments, and other procedures and treatments that will come your way just by virtue of you having that relationship with that family now. So the red here is your total monthly return on investment. So it's well over $30,000 at a conservative estimate. And so the two focal points that I want you to have are the blue line and the red line. For the senior associates, the blue line is more critical because a senior associate is looking more at the passive revenue that can be derived. In other words, this is the revenue derived without having to actually do anything. just by being involved with the KidKuts network. So that's a passive revenue to, say, a senior associate, whereas the junior associate would be deriving this red line minus what the senior associate took away from him, but we could talk about that later. Why is KidKuts important now? KidKuts is important now more than ever before. We have a growing concierge market in the United States. Basically, people value more personalized, more immediately accessible care and more immediately accessible items. Things at the touch of a button, things that are on their phone where they can click an icon and it's there. Now, more importantly than ever, the marketing and practice management for offices is critical. So for our younger partners, younger associates, and fellows that work in our practices, we want to be able to have excellent outreach and marketing and be able to build the future of plastic surgery. The third item here is that KidKuts is a secondary and renewable revenue driver, meaning you create that relationship, you're engaging that mom, that dad, that grandmother, that grandfather. They're now in your office, they're a captive audience. They're gonna see that you offer skincare, scar management, laser, loyalty programs, other aspects of your practice. So this is basically the ultimate way to introduce families and create those relationships in your community. Most importantly, probably, is always going to be safety. And now more than ever, exposure is a real issue. We are able to reduce the ER exposure for parents and families and children. We're able to reduce the number of unnecessary ER visits. And especially in this post-COVID environment, it's a service both to that family to not have to sit in the ER and also to the other patients there and the physicians as well. So it's kind of a win-win-win in terms of reducing the exposure by increasing the efficiency of care.